This is the sound of refusing to give in. It's leaving nothing to chance. Searching relentlessly for the right, the only treatment option that will keep a heart beating. Fortunately, the Christ Hospital Health Network has groundbreaking treatment options unavailable anywhere else in the country, developed with help from our own physicians. That's what makes us Greater Cincinnati's Heart Hospital and one of the top heart hospitals in the world. The Christ Hospital Health Network, everything it takes.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 817, The Impact of the Hypertrophic Cardiomyopathy Center with Dr. Bhatia.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Hello, friends. Welcome to the Pound This Podcast. Before I get into this extremely informative conversation about HCM at the Christ Hospital, I want to tell you about some friends that can also help you along on your health journey. One is Sarah and Team Fit With Me. If you're looking for a health coach that can help keep you accountable, teach you all about nutrition, whether your goal is to lose weight, it is to maintain, it is to get stronger, it is just generally live a healthier life, Sarah can help you. I mean, she's got a whole team that will give you recipes for years. Jess on her team has so many recipes and can help you with your nutrition, help you with your hormonal health, help you with any sort of autoimmune disease that you have. I know I have Hashimoto's and Sarah has helped me with that. So if you're looking for somebody definitely with weight loss, reach out to Sarah. She has changed her pricing. So maybe you've reached out in the past and you're like, that's not in my price range. Just reach out to Sarah, ask some questions, and she can create an affordable option for you because your health is really important. And if you're struggling, it's so important to ask for help. So go to teamfitwithme.com and reach out to Sarah and see how she can help you with your health goals. And if you're here in Cincinnati, go to Clean Eats in Newport because their food is absolutely amazing. I've been a meal prepper for over a decade now. And it is so nice to have somebody else meal prep for you. You're going to have a lot more options. And plus for me right now, I am trying, because of the Hashimoto's, trying to stay more gluten-free. So there's a new menu that comes out every single week. So I'm picking and choosing the menu items that are more gluten-free for me. That's where I'm at on my journey. But there's low carb options. There's extra protein options. And that's just with the fresh meals. If you go in and check out the frozen meals, which you can grab at any time at Clean Eats in Newport, not only do you have the low carb options, the higher protein options, there's vegetarian options, there's all of their cauliflower pizzas, there's the big family meal options, and you can go in there at any time and grab those meals in as many as you want and give them a try. There's also the cafe, so you can go in and make your own bowls and get wraps and flatbreads. So if you're looking for a healthier lunch option, that's a place to go. Clean Eats in Newport, Chef's Kiss, if you are trying to eat healthier and make it more affordable, honestly, than buying all this stuff at the store, and also obviously make it very convenient. So check out Clean Eats in Newport for your meal prep needs. Check out Team Sarah or Team Fit With Me and Sarah for your health coaching needs. And right now, let's talk about your heart. Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine, and I am excited to explore a topic that I wasn't even aware of, and I'm interested in learning more because I was unaware that the Christ Hospital had a specific center for hypertrophic cardiomyopathy, which I have just learned what that is, and I can't wait to learn more. So I have a doctor joining me from the Christ Hospital. I will let you introduce yourself because I don't want to mess up your name or your credentials or anything you are because you're kind of a big deal. So I'll let you go ahead and introduce yourself.
Thanks so much, Amanda. My name is Ankit Bhatia. I'm a cardiologist specializing primarily in advanced heart failure and transplant, but I'm also a director of the Hypertrophic Cardiomyopathy Clinic here at Christ. A little bit more about my background. Grew up in Syracuse, New York, was a long-time cross-country track runner, so got into this condition specifically because it's a condition that's more prevalent and common in athletes specifically. A little bit more about my journey, made my way over to Chicago, did med school at University of Chicago, and then finally went down to St. Louis to go to WashU and finished off my fellowship training there. And when I got to Christ, I was joined by my senior mentor and co-director, Dr. Mazur, And we were already treating hypertrophic cardiomyopathy. It's a well-known condition, but really wanted to kind of universalize it and standardize the care of it across the spectrum of our hospital. One thing we know about this condition, and we'll get into it more, is that it's a condition that really requires treatment on many different facets. And we found out that us and many others weren't doing it well. So as part of our clinic that we created, we standardized how we treated patients, had them be seen by us as well as all associated specialists, and now have this established clinic that we're seeking National Center of Excellence accreditation. So it's been an exciting time, and I'm excited to talk more about the condition.
Yeah, so tell me what the condition is and why that's important that we know what it is.
Yeah, so hypertrophic cardiomyopathy, it's a genetically mediated heart condition, meaning that it's not something that you do to yourself or you can help prevent. It's something that you are born with. And what it is an abnormal thickening of the heart. The heart is basically working too hard. It's contracting too much, and it leads to this abnormal thickening. It can manifest in a lot of different ways. It can lead to things like dizziness and passing out. It can lead to rhythm abnormalities, including palpitations. And it can lead in the more advanced stages, rarely, it can lead to heart failure. And the reason why it's so relevant is very rarely it can lead to what we call sudden cardiac death, or people having rhythm abnormalities that cause them to not have enough blood flow to their body. These are the athletes and others that we see very rarely die suddenly. And that's why it's a condition that requires so much vigilance and greater awareness, so we can better identify these folks beforehand if possible.
So are we having those symptoms when we're doing a hard physical activity, or is that just randomly happening? I'm just walking down the street, I'm sitting at my desk, and I start feeling some of these symptoms.
So, taking a step back here, this is a widely prevalent genetically mediated heart condition. And what that means is that we think between 1 in 300 to 1 in 500 patients in the US have them. And only about a fifth of those we think are actually being diagnosed or less. So there's a lot of folks walking around with this condition, and the bulk of them, it's going to be fine. They're going to be asymptomatic, actually. But in terms of folks that do develop symptoms, which are the minority, but among those folks, usually what ends up getting started is some symptom that's abnormal to them. And what I see most common is, they're not able to do the activities they typically think of in their normal life, or exercise intolerance. Everyone is different. I've got patients that are marathon runners that are coming in and telling me, I used to be able to run at X pace and now I can't. And I've got other folks that say I can't do laundry the way that I used to, So it just kind of spans that spectrum. Some people come in more with rhythm symptoms. They say, oh yeah, I feel my heart race in my chest. And others come in saying, oh, I feel lightheaded. So it's, there's no one size fits all, but that's kind of the three general bins I see is exercise intolerance, maybe some rhythm associated symptom, palpitations, or folks feeling lightheaded or dizzy.
So is this something that gets, I guess, worse, or like the thickening gets thicker, I guess, with age? Is something that maybe didn't affect us at 21, but might at 41?
So, what we know is that the average age of diagnosis usually lands somewhere in the 30s to 40s range. So that's when folks are typically manifesting symptoms, but usually the bulk of the thickening of the heart is occurring earlier in life than that. But everybody is different, and that's why this condition is such a chameleon in that way. There's no one size fits all in that way. But it's something to be recognized, not just in people, but in folks in their middle age as well. If they are to develop symptoms that would make them different, but the bulk of the actual thickness of the heart usually happens a little bit younger.
Okay. Well, and you brought up that it's prevalent in athletes. So if it's happening to 1 in 300 or 1 in 500 adults, like why is that more lean towards an athlete? Is that just because they're exerting themselves more where this can become more prevalent? Or is it just like that type of genetic person tends to be an athlete?
So maybe I'll rephrase that a little bit. What it is that, we think about heart conditions, and many of them are caused by environmental factors, things like high cholesterol, smoking, and things along those lines. So when we think about a standard athlete, usually they have a lower risk of most heart conditions on the whole. But since this is a genetically mediated condition that often is diagnosed much earlier in life, most things, coronary artery disease, heart failure, whatnot, these are diagnoses made in people's 50s, 60s, and 70s. It's one of the heart conditions that we see and younger patients. And because athletes exert themselves more so, they're more likely to develop those symptoms and have those manifest. So when we think about it, it's still exceedingly rare overall in athletes, but it's one of the few heart conditions that we do see in them because it doesn't matter what you do. You can't modify your risk of getting this. And therefore, when you do have symptoms, it's something to seek out to determine what's going on.
So since it is a genetic disease, is this something worth getting some genetic testing done to see if you have this, or if your genetics say that this is going to happen?
Yeah, so what I'd say is a good starting to a place is that, say you're an athlete or anyone for that matter, and you've got some symptom that's different, the symptoms we described. I think the first thing to do is go seek out your doctor or healthcare specialist in some way and talk to them about your condition. And if you guys collectively think that a workup's warranted, what they may order is an echocardiogram as part of that workup. And what that is an imaging test of the heart to look to see what's the squeeze or the heart function, what's the relaxation, and what's the thickness of the heart. And based off that, we can usually diagnose hypertrophic cardiomyopathy. And what the definition actually is, an abnormal thickness of the heart, we by definition is over 1.5 centimeters or 1.3 centimeters with a genetic test that's positive. What I'd say is first to have the diagnosis established. And then if you do have the diagnosis established, part of our workup for a patient that we see, a new patient with this condition, is to actually get them plugged in with our genetic counseling team. We have a fantastic genetic counseling team that goes through all the logistics of getting genetic testing, including what it would look like if a test is positive or negative for a person, as well as what the next steps to take is for their family. So I'd say for a patient concerned that they may have this condition, first see if you actually have it or not, get diagnosed. And then from there, if you do have the condition, genetic testing is actually something recommended in the guidelines and something that we are universally recommending to our patients and that we see in our hypertrophic cardiomyopathy clinic here at Christ. The other thing, Amanda, I want to mention is that this is a condition that runs in families. And as a result, one thing I see a lot of, unfortunately, is I will find a patient that has this diagnosis and I'll ask them, hey, have you been genetically tested and have your children been screened? And overwhelmingly, unfortunately, the answer has been no up until this point. So what I encourage is the patient, whoever the patient in the family is, get tested. And if there's then an indication to get the family tested, then our genetic counseling services can offer that to them as well. So you always start with the patient with the disease in the family. And then from there, the first degree relatives can be tested if that patient tests positive.
So after that, and let's say that proves positive for them, is there, once you're already diagnosed, is there anything that you can do? I guess it wouldn't be preventative at that point, but how do you maintain this? Is it diet and exercise? Is it medicine? What are the next steps from there?
Yeah, and that's a tough question to answer. So say, let's take a hypothetical family. You've got a mother who developed, lightheadedness, dizziness, came in, got an echocardiogram, and was diagnosed with hypertrophic cardiomyopathy. She then undergoes genetic testing and tests positive for a gene that is associated with development of this condition. And about 60% of patients with hypertrophic cardiomyopathy will find a gene that's positive. Her family is then given the option of testing, and her son goes and gets a genetic test, and he's positive for that same gene. So that does not necessarily mean he will develop hypertrophic cardiomyopathy. That just means that he is predisposed or more likely to develop it. So then what the best thing he can do is get checked out regularly in our clinic or by a healthcare provider to ensure that he never develops that associated thickening of the heart or any other symptoms that would be concerning. It's all just about strong vigilance and making sure you have a strong relationship with whether it's our hypertrophic cardiomyopathy clinic or another healthcare system, so that a patient can ensure that they don't develop the disease if they got the genetic risk factors for it.
Okay. Well, I know that this clinic is one of the only ones in the region at Christ Hospital. Can you talk to me through the process of that? Is that something that you were seeing was so prevalent and you're like, this needs to have its own center, or how did that work out?
Yeah, it just, as we were mentioning, there's just so many facets to this condition. You got the abnormal thickening of the heart in hypertrophic cardiomyopathy, and that can lead to obstruction of blood flow to the rest of the body. It can lead to abnormal rhythms, including life-threatening rhythms, and it can lead to heart failure. So what we realized was that, you know, before we started this program, doctors in our system and other systems were treating the condition well, but unfortunately, we're missing some of the downstream components. For example, folks that had very severe thickening, many of them were getting procedures done where that thickening was cut down, or what we call septal reduction therapy, but then they weren't being followed along to see if anything would happen to them thereafter. It was kind of like a one and done. And the other thing we were seeing is that we were not doing as great of a job as we need to get folks the genetic counseling resources they needed. Families were not understanding that if they had the condition, their children and first degree relatives also needed to be screened for it as well. And then this condition has a lot of other conditions associated with it. People with hypertrophic cardiomyopathy are more likely to have sleep apnea. They're more likely to have diabetes and hypertension. And we weren't doing a good enough job treating those associated conditions as well. So the whole point of this clinic was to standardize our care, ensure that we're following guidelines to ensure that we're taking care of the patient best in front of us that we could, and then also giving them all the associated resources so that it was a team approach. Every single patient that gets seen in our hypertrophic cardiomyopathy center sees myself or my senior mentor, Dr. Mazur. And then from there, we have a team that can discuss each of these patients individually, and we can decide if they need more assistance in the electrical side by our cardiac electrophysiologist, or in the heart failure side by one of our heart failure specialists, and we can refer from there. This sort of approach is our first step to try to getting national accreditation, and we just had our site visit for that by the Hypertrophic Cardiomyopathy Association. We're waiting to hear back from them. But the whole idea is that there's also national organizations seeking out clinics to ensure that we're following guidelines and ensuring that patients are being treated for their whole patient journey, not just one component of it. So that's why I think it's so relevant, and why we shouldn't just have this be treated by a single individual or a single sort of cardiologist in that way without a team, because I think there's unfortunately the risk of so much of this condition being missed because of that.
Well, that just seems like such a stress reliever for somebody that is going through this, to be like, I know that there's this whole team focused on me and figuring out what's going on with me. Because, I mean, having any sort of diagnosis is not really a pleasant experience for anybody. And so I imagine it helps your patients so much. Just be like, I'm in good hands. I'm being taken care of. This is something that is hyper focused on what is going on with me, and that has to make the process at least a little bit easier.
And what's been the beauty of it, since we launched this clinic in October, is just the familiarity of not just us, for our whole team. The nurse that I work with in clinic has really just become a complete expert on the condition herself, and she's counseling patients consistently over the phone, outside of visits as well. And our entire team has really bought in. We see full days of patients, 14, 15 or more, that have this condition. And as a result, when you really streamline the condition, streamline all the associated specialists that can help out, then you know that you're not missing things. And that's what's most important. Because as I mentioned before, the bulk of folks with this condition, they'll be fine. And what we know about hypertrophic cardiomyopathy, and this is a big point to bring up, if it is well treated and recognized, people with this condition live just as long as people without it. But the reason why they may not is if components of the care are missed.
So is this something that if somebody is listening to this podcast and might already have this condition or be interested in getting some genetic testing and figuring that out, and let's say they don't live in Cincinnati, because you're building this out in Cincinnati, is this a center where somebody might be in St. Louis and be like, oh, I can go to Cincinnati and have this team? Does it work that way? I don't know how this stuff works.
So what I'd say is that the way we've been getting started with it is that what we like to do is have all of our patients seen by myself or one other specialist initially, and we go from there. So any patient has the option. If they have we prefer they already have a diagnosis, but if it's a family history or a gene positivity that puts them at risk too, that we're more than happy to see them as well. Where we see them initially in our hypertrophic cardiomyopathy, we have designated days and locations. We have one location down at Mount Auburn and another location in Montgomery where we are just seeing patients with this condition on those days. We'd see a patient that would have the condition or is at risk of it, and then from there, ensure that we're treating them at all facets of their disease, following guidelines well, making sure they get the all appropriate imaging, as well as making sure they're assessed for their risk of developing life-threatening rhythm abnormalities. And we do that full assessment there. And then we can see them at a cadence as frequent as they're able to, or we feel is needed. We've got patients well north of Dayton area, 3-4 hour drive coming. We've got folks from the Kentucky area, deep in Kentucky, that are coming as well. And we're more than willing to work with specialists in other systems. We've had collaborations with Premier and Kettering. I'm up in Montgomery, so most of my collaborations have been up north, where that is still their primary cardiologist. And we as cardiologists in the Hypertrophic Cardiomyopathy Clinic are acting as consultative specialists just to help to guide the care, but not trying to take away from that real relationship that patient may have with another doctor. And we've been doing that across systems as well within the city. We've seen patients from TriHealth and Mercy. They still have their main cardiologist over at Mercy, but they come to see us once or twice a year, and we'll chat, and then we can kind of ensure that everything is being done correctly.
Okay, but if somebody is before they have a diagnosis and might be listening, that might be at the beginning of that journey, it kind of starts with your primary care.
Exactly. Starts with your primary care. And if you've got a concern about it, I think the first step would be for your primary care to evaluate, consider an echocardiogram. And really what I want to make clear is if someone's got a family history of hypertrophic cardiomyopathy, or in many cases, including my wife's case, it was never told that she had hypertrophic cardiomyopathy in her family. It was told that people had heart thickening or a heart condition, and later was found out that they had this condition running in their family. If you have abnormal heart conditions, people dying suddenly in your family, heart failure, or any other conditions, and have symptoms develop, that's even more of a reason to get checked out to figure out what's going on.
So did I catch this correctly that your wife has this condition?
No, she doesn't have it, but in her family, folks do.
Okay.
And we didn't know that for a while because many of them live in India, and there was basically the diagnosis was never made. So there was people trying to describe it that did not really fully understand it. So we didn't know it, but luckily we got her tested, and she so far doesn't have it.
Okay. Well, man, that's just got to kind of fuel your fire in your work to be like, this hits close to home if it's, affecting your wife's family. And then this is like this specific work that you're doing.
And here's what I love about it is that because it's a genetically mediated condition, once you have a patient diagnosed and they come see you, you start to get whole families that come see you. And it's what's so wonderful is they can share in the patient journey together. And that's probably one of the biggest reasons I love this new role is that you get to really develop those great relationships and really have them seek out the resources they need together as a family. The other thing I want to bring up too is that, this field has really changed. For the folks that are most at risk and most symptomatic, some of them with hypertrophic cardiomyopathy develop obstruction. And what that is, and that's actually roughly 2/3 of patients that get that among the diagnosed HCM patients, 2/3 develop obstruction. What that means is that to some degree, there is poor blood flow getting to the other organs and being obstructed at the level of the heart. If you think about it, if your heart is thickened, it may prevent blood flow from exiting through the aortic valve and into the body. And so for a long time, the medications we were using, including beta blockers and calcium channel blockers, were all we had. And they had a lot of symptoms, and for many folks, it wasn't enough. And for those folks, all we had left was really surgery or other invasive options to basically cut out that area of thickening. In the last year, there's become a new medication available, and they're the myosin inhibitors, and the specific medication is called mavacamten. It's a medication that I felt has really changed the game because folks previously requiring surgery now have a non-surgical option that is working dramatically well. Since it's a new medication, it's restricted in who can prescribe it, and within Christ, only within the hypertrophic cardiomyopathy is it being prescribed, but we're the larger prescribers of this medication in the whole region now. And I've seen such dramatic improvements in people's quality of life. People who are in their 50s, who had been limited for 10, 15 years with shortness of breath and dizziness, now saying, I feel like I'm 30 again. So I think the beauty of this new medication hitting the market around the same time that we started this clinic has really provided a true value add to the clinic because we have more weapons in our arsenal to help treat patients.
Yeah, that's amazing. So for anyone listening, is there any other resources you would recommend they go check out? So obviously they're not going to just like reach out to you because they have to go through their PCP and go through this process. But is there anywhere that you would recommend sending them to get more information, to get educated on this topic or educated on what Christ Hospital does?
Yeah. So, what I'd say first off, for folks that already have the condition itself, please check out our website and we can provide a link to it where we have a hypertrophic cardiomyopathy clinic set up. You can learn more. From what I found to be an amazing resource is the Hypertrophic Cardiomyopathy Association, HCMA. It is a very powerful and very active patient advocacy association that do a lot of helpful resources that are more patient-driven. So it's not just your doctor educating you about this condition, it's other patients. And it's very unique in the cardiology space that you have such an amazing advocacy organization that is so supportive of patients. So I definitely advise them to get involved. And folks that don't have the condition, I would definitely say, first seek out your primary care if you're having the symptoms we talked about and see if you do. And if you do have the condition or you have anyone in your family with the condition and you're concerned you may have it, we're happy to see you in our clinic as well. And again, you can go through the Christ Hospital website for hypertrophic cardiomyopathy, and the ability to schedule will be right there.
This was an amazing conversation. I learned so much, and I'm so excited for all that you're doing at Christ Hospital. And thank you so much for your time to educate us on this topic.
Awesome. Thank you so much for having me, Amanda.
AmandaValentineBites.com